I want to read the first sentence from a Stanford medical news article about AI documentation. So it says, quote, clinicians at Stanford Healthcare will soon have access to an AI-powered app that can securely listen to interactions with patients and automatically generate draft clinical notes. So we know that that's available right now. I'm using HippoScribe. We're figuring out the workflows for this. And one of the first things that I want to implement, roll out for my clinic is an old idea. I mean, really, really old idea that I want to bring in to modern times. So back in the day, we had an admission process. It was a telephone admission process where either one of my clinical staff or one of my administrative staff would receive a phone call from a new patient. And you know the typical drill. So the phone rings in the clinic, you answer it. Hi, my name's John. I have a referral for physical therapy. And the person on your side of the phone begins to collect the information. Normally it's name, telephone number, reason for therapy, insurance information, so on. What we used to do was we would collect all of the basic initial information, and then we would take that information, schedule the patient. Usually we're trying to schedule within 24 hours of the initial contact so that we get the initial evaluation completed. And we would say, okay, great, John, thanks so much for calling. What I'm going to do is I'm going to go ahead and verify your insurance coverage, and I'm going to give you a call back to review your insurance coverage. And if you have just 10 minutes, I will go through a series of questions so that you will have zero paperwork to fill out when you arrive. How does that sound? And then usually you'll arrange a time, preferably a time that the either administrative person or the clinician has opening on the schedule. You hang up. When that time rolls around, somebody will give that person a call back, and you effectively can collect most of your initial evaluation information. And it doesn't have to be the physical therapist who does this. It can be an administrative person. It could be a patient care advocate. It could be a PTA or a PT, but you would go through, tell me a little bit about what's been going on. How did it start? Is it getting better? Is it getting worse? Have you seen other healthcare providers for this condition? You would collect past medical history information, past surgical history information. If you're really good, you would go through some of the functional outcome measurements. So you would ask the questions associated with the lower extremity functional score or the oswestry back index or whatever functional tool you want to ask about. And you would compile all of that information into a document that would go into the medical record so that the treating physical therapist would be able to review all of that prior to the patient's arrival. That gives the therapist the best opportunity to initiate building rapport, building confidence, let the patient know that we're all on the same team, we're all working from the same information. And I remember it was just the most smooth transition from first point of contact to initial evaluation. And the more time it saved me, the more opportunity I had to get into treating the patient sooner rather than the patient arrives, they spend 10 to 15 minutes filling out paperwork. Then you go back for the evaluation. You spend another 10 to 15, 20 minutes going over the paperwork. I want to eliminate all that. So what does that look like in 2024? Well, using HippoScribe with proper consent, with proper release forms so that the patient understands you are going to record the conversation. You can have that same telephone conversation, which is a non-billable event, but what it does is it better optimizes the initial evaluation and the first face-to-face contact so that you can potentially start billing a treatment unit sooner than you otherwise would have been able to. And so if you are set up to record the telephone conversation with the patient's consent, that recording goes straight into HippoScribe. That recording will then be transcribed, paraphrased into your initial evaluation template so that all of that information is already in your system, ready to go. It eliminates the need for the patient to log into the patient portal and try to answer the questions themselves. It eliminates the need for the patient to come in early and fill out paperwork before the initial evaluation begins. And most importantly, it provides your clinician with the best possible information from that conversation to initiate care, to build trust, to build rapport, and to let the patient know that ultimately we're here to treat them. We're not here to put our face in a computer and ignore them.